Hello and welcome to Vatech America. Today we come to you from Cypress, California, the site of our brand new state-of-the-art facility and world-class showroom. I'm sure your decision to choose Vatech wasn't an easy one with so many options on the market. At the end of the day, whatever led you to Vatech, we're grateful that you did choose us as your imaging partner. It could have been from a variety of different reasons: image quality, support, industry-leading warranty, or the education platform that you're going to experience here today. Ultimately, our job as your imaging partner is to ensure that you and your team implement this technology seamlessly. Enjoy the next hour with the Vatech Education team, and thank you again for choosing Vatech America.
Welcome to your Vatech Education experience. At the conclusion of today's sessions, you will understand the available modes for your new Vatech device, be able to accurately position patients, resulting in high-quality images, and also efficiently navigate the Vatech software.
In addition to this training session, Vatech America has created a customized educational experience for you. The Vatech Education Academy has over 250 hours of on-demand content right from our website. We broadcast weekly 20-minute lunch and learn sessions on various clinical topics and ongoing training sessions customized for you.
Before we begin, I would like to point out the chat feature on your screen. This allows you to chat with Vatech team members during your training session.
Before today's live session, we prepared a presentation of our software workflow, including the most common questions and concerns, including CBCT image acquisition and how to identify patient movement, panoramic troubleshooting and image quality, CBCT exporting, and an introduction to our 3D software, EZ3DI.
Thank you for choosing Vatech as your imaging partner. Here we are at our Vatech Education Academy. We are at vatechamerica.com/education. Let's look at some of the content within the Academy portal. Here you will find options to connect with a training specialist, launching our team viewer, or FAQ area for frequently asked questions. The quick reference area provides short training modules answering the most common questions that we receive. Videos and resources. The bulk of our education modules are located here. Viewing left to right, you will find device video modules including imaging for 3D, 2D, and intraoral tutorials, followed by software modules, and finally recorded webinars, which include past lunch and learn sessions and clinical partner sessions with industry key opinion leaders. To access, simply select your area of interest and create your account. Selecting a device or software option navigates you to the training modules. This will be an overview of the Smart Plus device. Let's start with the on-off switch. The on-off switch is located underneath the horizontal arm. It's a green toggle. You want to toggle that on in the morning. You'll notice that the device overhead will rotate and go through a startup. In the evening, you want to power the device down. Next to the on-off switch is the red emergency stop switch. If there's an issue, you can depress this switch and it will cut power to the overhead. If you rotate the switch, power will be restored. The front of the device is where the touchpad is at. It includes the up and down of the column, Frankfurt horizontal beam positioning, open and close of your temple supports, and finally the ready button. Once you've positioned your patient, click the check mark. On the side of the device is your canine beam. The device also includes your hand switch for the up and down of the column. Next, let's look at our appliances. The Smart Plus device comes with 3 separate Bite appliances. Here I have our Bite stick. On this side compartment, other appliances are included. We have our shorter edentulous cup and the taller two-dimensional TMJ and sinus appliance. The bite stick will be used with the tall chin rest, as will your edentulous cup. It just sits down in the device there. Your taller TMJ sinus appliance will be used with the shorter chin rest, which is located on the side compartment. Also within the side compartment are your bite block covers. Go ahead and replace our bite stick, and we can put our appliances back in the side compartment. One other appliance I would like to look at is your model scan platform. Your model scanning platform comes in this case, which I'll remove. To install the model scanning platform, we're going to remove our chin rest and add this into the device. We'll go ahead and reinstall our chin rest. Lastly, let's talk cleaning and care. To disinfect the device, you want to use a hydrogen peroxide-based cleaner, and you want to have it on a wipe. You do not want to spray into the device, so have that on a wipe. Wipe down our areas. Let that sit per the manufacturer's recommended time. Let's grab a dry cloth and then wipe off any excess. Finally, I want to talk serial number location. The serial number is located on the lower right of the column and starts with 069. This is important if you do need to call into Vatech, your dental dealer, or if you are talking with our education team. You want to have this number available.
To take a CBCT, we are going to start inside of EasyDent Eye with a patient chart open. Be sure to have the correct patient chart up, as when taking a CBCT, it digitally burns the patient's name into the DICOM files. From there, we simply click on the Acquisition tab from the top panel and select CT from the left panel. It will then open the CBCT interface to make our selections. Beginning with the gender options on the lower left of the screen, options include man, woman, and child. Note, if the patient is 12 or under in the system, it will automatically select child as the default. To the right are the patient size density settings. Options include hard, normal, which is your default, and soft. Now let's take a look at our scan sizes. This device is very simple to use. There are two sizes, 10 by 8.5, which is anatomical 12 by 9 centimeters, which will include dual arch full dentition. So that is 10 centimeters in diameter by 8.5 centimeters high. The smaller scan is a 5 by 5 size scan, perfect for one tooth. So that is 5 centimeters in diameter by 5 centimeters high. Starting with our largest field of view, the system defaults to the 10 by 8.5 scan. Nothing else is needed to be selected, as this will encompass full dentition. Please note, the Smart Plus system has included an AutoPan option generating a separate panoramic image from the CBCT scan. This can be enabled in system settings. Moving to the smallest size 5 by 5 is appropriate for a single tooth. First, we select the arch under the vertical options, then we select an area under the tooth options section. For ease of use, simply select the desired anatomical area. Your Smart Plus device will adjust to capture the area that was selected in the console window. Additional image options for all sizes include high resolution for best quality and the green setting for reduced radiation. Also, below this you have voxel-based options that include standard for highest quality and application, allowing a larger voxel size. Also notice the message information area across the bottom left of the screen, always displaying the status and the next steps to take. Once we have made our selections, we can simply click confirm and the machine will rotate to capture position and we can position our patient. In preparation, have the patient remove all metal objects from the neck up, including necklaces, eyeglasses, earrings, and any other metal objects.
The Smart Plus device has two fields of view, a 10 by 8.5 and a 5 by 5. Positioning the patient for both fields of view is the same. Let's go ahead and bring our patient in and we can go through our patient positioning protocol. Go ahead and stand up straight and tall for me. I always have the patient stand up at attention so we don't have any slouching or issues there. The first thing I do is I ensure that the chin rest is just below their chin. So I can move the entire device up or down, but I want to get that right to the base of their chin. And I'm going to step over here and I'm going to have the patient start with your hands. So go ahead and hands, palms facing up. Feet, go ahead and walk forward until your feet hit mine. What we're ensuring is we're ensuring our patient is standing up perfectly straight. Then I'm going to have the patient go ahead and open and bite on the bite stick and smile really big for me, and I'm ensuring the patient is biting in the bite stick groove. And you can see there's a little space here underneath her chin. I'm going to go ahead and gently push down on the chin rest to ensure that the patient's chin is firmly on the chin rest here. And that was just gently pushing down on the bite stick here. So the next thing I want to do is I want to ensure that the patient is lined up center using our mid-sagittal beam. There are 2 points of reference. I want to make sure it's right between the eyes and right here through the philtrum. So I'm just going to gently move the patient's head, and we can see that now the line is lined up right through the center of the patient's face. Other thing to ensure with CBCT capture is that the patient's occlusion is flat or parallel with the floor. I use the maxillary occlusion as a reference. We want to make sure that that maxilla or the maxillary occlusion is flat. So smile really big for me, and I'm looking at the occlusal surface there. And if the patient's tipped up too high or tipped down, I can always raise or lower the machine. In this case, the patient has a very flat occlusion. We also have a red positioning beam shining on the right side of the patient. I use that as a reference to ensure that that occlusion is flat or parallel with the floor. Once our patient has been positioned, I'm going to go ahead and close our temple supports. Ensure that the patient is lined up center still. And the instructions I give to the patient are that I would like them to go ahead and close your eyes, just relax and breathe through your nose. And also tongue position. With CBCT, we can just have the patient relax their tongue. Next, I'm going to hit my check mark, which is my ready button on the machine.
Image capturing position. Please wait.
The device will talk to the patient. And lastly, what it tells the patient is to have them close their eyes. I stay in the room until this is ready to capture.
Please close your eyes until image capturing is complete.
Next, I'm going to tell the patient I'm going to step out of the room, go ahead and relax, and we're going to go ahead and take our image.
Hold the button on the acquisition trigger switch, which will turn yellow and expose it. Hold the button until the image acquisition is fully complete.
Please open your eyes and follow the operator's instructions.
Once capture is complete, the temple supports open, and we can go ahead and let our patient out of the device. You can just go ahead and step over there.
On our acquisition computer, the scan will automatically save to the patient chart within EasyDent Eye. To open the scan, click on the Patient tab and double-click this to open for review. Chin rest with normal bite stick. Special bite B or edentulous rest with normal chin rest. Additionally, use a cotton roll to separate the bites. Special bite B with short chin rest. Utilize the short chin rest with special bite B edentulous rest. Notice the 2 different size chin rests that are included with your machine. Be sure to use the smaller chin rest for this example. This combination is used when it is clinically necessary to capture additional superior into the sinus. Note, the inferior border of the mandible will not be captured when using this combination. Also, it is not possible to utilize the regular bite stick with this shorter special chin rest. You may also have the patient seated if they have trouble standing. Ideally, it is a good idea to use a chair with rolling feet and have the patient slide toward the device. The same protocol applies when the patient is seated. Have the patient hold in the underhand position on the handrails. Have the spine straight up and chest close to the device, and have the patient bite on the bite stick and continue standard protocol. To take a 2D panoramic image with our patient chart up within EasyDent Eye, we simply click on the Acquisition tab on the top of the screen and select Panorama on the panel to the left. First, we begin with patient gender, man, woman, or child. Note, the system will automatically choose child if the patient is 12 or under. To the right of gender, we have exposure-based settings based on the patient's density or size. Options include hard, normal, which is your default, and soft. Moving to the right side of the screen under the panel options are the normal setting, providing a standard panoramic image, and the magic pan, providing a single optimal panoramic image having multiple focal images combined into one. Moving on to the image options below this are high resolution for best quality and the green setting for reduced radiation. Note, when using the green setting, the scan time goes from 13 seconds down to 7 seconds, making this an ideal setting for any patients that have stability issues. Next, select an arch size selection below. Options include narrow, normal, which is your default, and wide. Moving down to the panel examination area, standard is your default, capturing all dentition and condyles. Additional options include right side only, left side only, and front. Also notice the message information area on the bottom left of the screen, always displaying the status / next steps to take. Once completed, we can simply click confirm and the machine will rotate to capture position and we can move on to position our patient.
In preparation, have the patient remove any metal objects from the neck up, including eyeglasses, earrings, necklaces, or any other metal objects.
Smart Plus 2D panoramic capture. First, I'm going to go ahead and bring my patient into the machine. Go ahead and stand up straight for me. And again, I'm going to get the chin rest just below her chin by moving the column up and down. And then I'm going to walk over here and we're going to do the same thing. We're going to start with our hands, our feet, and then bite on the bite stick. So go ahead and bring your hands up and palms facing up, feet shoulder length apart. And I'm going to go ahead and open and bite and smile really big. I can see the patient is in the bite stick groove and chin's off the chin rest a little bit. I'm going to gently push down to ensure that chin is firmly on the chin rest. So 3 steps in positioning for our panoramic. First, I'm going to start with my mid-sagittal beam, ensuring the patient is lined up center, looking right between the eyes and right through the philtrum. If I do need to move that, I'm going to go ahead and physically move the patient's head to make sure she's lined up center. With our panoramic capture, we want to make sure that the patient's occlusion is tipped down about 10 degrees. What we're looking for is a natural head position. So if I have my patient smile right now, I can see that her occlusion is flat or it's slightly tipped up. So what I want to do is tip that chin down. And I'm going to do that by lowering the chin rest down. What often happens is whenever you position your patient and you start to lower the chin rest, they start to hunch down. So I'm going to gently push on the back of her head here. And I'm also going to lower this down. And as I do that, go ahead and smile really big for me. I can see that her occlusion is tipped down at about a 10-degree angle. We also have our Frankfurt horizontal beam shining on the right side of the patient's face. This is a reference you can use for that natural head position. I'm going to bring this up and it's right at the top of the tragus or the top of the ear canal. And I'm going to run it right through the infraorbital notch of the eye. That is another reference where we can see, and if she smiles, I can see her occlusion is slightly tipped down at about a 10-degree angle. Next, I'm going to go ahead and close my temple supports by clicking on the button here. Temple supports close, double check my mid-sagittal beam, and lastly we have our canine light. You can see it shining on the left side of the patient here. To adjust that canine beam, I can use our slide bar and move this anterior to posterior. Go ahead and smile really big for me. Perfect. All right, go ahead and relax your lips. We have our patient positioned. I'm going to go ahead and click on the check mark or the ready button here.
The system is moving into image capturing position. Please wait.
The device does provide instructions again to have the patient close their eyes. In this case with the pan, I'm going to wait until it tells the patient to close her eyes, then I'm going to go capture the image. All right.
The system is ready to capture an image. Please close your eyes until image capturing is complete.
The other thing with panoramic capture is I want to have the patient close their lips around the bite stick. Go ahead and swallow and keep the tongue flat to the roof of the mouth. Hold that position. We're going to go ahead and step out of the room and take our image.
Hold the button on the acquisition trigger switch, which will turn yellow when exposing. Hold the button until the image acquisition is fully complete.
Image capturing is complete. Please wait a moment.
Once capturing has been complete, we can come back in and let our patient out of the machine once the temple supports open.
Please open your eyes and follow the operator's
Go ahead and
instructions.
open and go ahead and take a step back. So Paul, we just went through, patient positioning on the cone beam here, and I think it's important to do a little bit of talking about CT image quality and evaluation. Would you agree?
Yeah, absolutely. Taking a look at your images immediately after you take them is a great idea to verify you captured the proper anatomy and making sure everything looks the way it should.
For sure, and I think that also does then the patient's still there, and then do I need to retake the image because I've just evaluated? So that's going to be save a lot of headache for the office and the patient. So Paul, what really causes distortion whenever we get poor quality images?
Well, the distortion, the number one issue that we come across training clients is definitely patient movement, I would say, is a big factor, making sure that the patient is secured in the machine, you have the temple rod secured, clicking that acquisition button, ensuring that they're not moving, because when the patient, if they move even the slightest bit, you can see some ghosting and distortion in that image, for sure.
Yeah, we just talked about that of ensuring the patient's stable and all those things. So let's look at, I'm going to bring up one image here, and I'm going to bring up this virtual rendering we can see, and look how clear it is. I mean, I'm seeing clear definition on the root tips all the way through the mandible in this image here. Now, what happens when we see patient movement? What are you seeing here, Paul, on this image?
A lot of blurriness. You can see there's not much definition around, in the gum area, and it's overall blurry because of the patient movement.
Right. Yeah. Let's look at a comparison here. Here's a side by side. I mean, there's no comparison there, but yeah, the blurriness on the left is definitely from patient movement.
Right.
Paul, I'm going to open up a data set here that is a really clean image, and actually it's the data set from the image on the right hand side. So I've got it open right here, and we can see as we go through this, let's even look at our axial cut here, and I'm going to scroll superior inferior. You can see nice clean definition on this data set here. There's really no distortion.
Right.
Clean lines there. So let's go back into our EasyDent Eye here, and I'm going to go ahead and launch another data set here. So I've opened up the data set, and this one you can see a lot of distortion. And Paul, I'll let you kind of run through, and we can start with the virtual rendering, maybe move the axial and then the coronal, and kind of describe what we're seeing here.
In this case, it's a situation where the patient, as the scan was being taken, because we can see that the one side is fairly clear, they moved during the scan, so causing that entire right side there to be completely distorted. And you can see it especially in the coronal view, where they probably moved their whole head, moving that jaw left and right there, creating that kind of a ghosted image. You kind of see the jaw there about 3 times in there, creating that overlapping ghosting image there.
Yeah, I agree. So I'm following the ramus down here, and then as you described, here's another ghosting, so you can see a lot of ghosting through here, whereas we look on the patient's left side, look how clear it is here, which is also translated in the mandible, patient's right side versus the left side right here. Yep, on there. So that's a very good example of looking and recognizing patient movement within a scan. I'm going to go ahead and jump back EasyDent Eye software here. Did you want to add something here?
I was just going to say the reason is a lot of these times because we see essentially where the ramus is, you see 3 separate images almost. That's probably because they just quickly move their jaw because the machine's going around. So if they do a faster movement of their jaw, you'll see more ghosted images like that.
Exactly. I agree. Yep. Let's go ahead and open up EasyDent Eye. And I did want to highlight a couple of other images here. And here's another image where we've got patients with patient movement here. You can see on the anterior, you've got ghosting images, a ghosting of the incisal edge, and several layers of distortion there. And in another comparison here, we've got left side, you see that streaking effect, and on the right side, really clear, nice definition on the data that we're seeing there. Also wanted to touch on something else you may see in the cone beams, and this shouldn't be there. So if you do see any circles within the data, you can see here we have got one circle, two circles within the axial cut, and some long, dark vertical lines in the other. This is where the device needs to have like a beam alignment or some internal adjustments on there. So if by chance you do see that, that is something else that we would need to have our service team log in and adjust. So Paul, we just finished up looking at patient movement. Now let's look at a little bit of distortion that you see or artifact you see in scans that's highlighted as scatter in the images. So what I'm going to do is I'm going to go ahead and enlarge our 3D rendering here. And we can see off of any dense areas, you can see a little bit of scatter or streaking effect in the image. And there are, our compressed sensing technology to reduce that, but you're going to get a little bit of scatter in the data sets, and that is nature of cone beam right now. And you can see what that looks like off the crowns here. Some dense objects is this streaking effect right through here. Let's go ahead and look at our axial cut to look at how the software handles that metal. So you can see our two implants here. And I'm going to scroll through and let's enlarge this and bring this to the center here. So you can see we have a very little scatter off of there, some streaking effect, but the software handles that very well through that compressed sensing technology through there. And we can scroll back down and let's look on our axial cut here off the gutta percha and our crowns. You see a very little streaking effect through there, but that is some of that beam hardening within the data set itself.
And that scatter, Jim, is basically the beam bouncing off of the restoration or the implant, creating that streaking.
That is correct. Yeah, it cannot pass through. Yeah, so it is a reflection off of there. And like we talked about, Vatech does have its third generation compressed sensing technology to reduce that down, but you will see a little bit of that scatter within your data sets. That's why it's very important to make sure, like we talked about when we were doing our patient positioning, to ensure that that patient is positioned and their occlusion is flat or parallel with the floor. Because the scatter only streaks horizontal through there. And I think that about sums up what we wanted to talk about. We touched on looking at scatter. We talked about evaluating patient movement. And then we also talked about if we see any distortion in the images with that, redoing that beam alignment on the device. So I think that kind of concludes what we wanted to review on CBCT image evaluation.
So Jim, why don't we talk about some fundamentals of hand positioning and common things that can occur in your images?
That sounds great, Paul. I mean, we just finished our patient positioning portion, and now let's look at images. And on screen here, I would consider this a high quality image. I've got my clear anteriors, a nice smile there. My condyles are straight up and down. So the question is, what do we look for in Pan IQ?
Right. Several things.
And why don't you describe on here, take me through what we're seeing here and what those 6 or 7 evaluation techniques we use to look at a pan.
Yeah, so the dashed white lines kind of outline just what we're looking at. We don't want the occlusion flat. We want a slight smile by having that 10-degree angle of the posterior teeth in there, which creates that slight smile you see there. You have the palate is nice and flat up there. It's designated by those white double-digit lines there. The condyles are even. One side's not tilted or larger than the other. And the chin there is in a slant position.
Right. So that's what we look for when we're evaluating. The thing is, we're working with patients and they may not be compliant to what we've asked them to do. And one thing that happens all the time, and you all know that, is where they bite on the bite stick too far forward. They bite in front of the groove, and maybe we don't have our canine light properly aligned. And Paul, what do we see here that usually happens when we're out of that focal trough?
Well, what we see blurry anteriors, and even in this one, it's the spine position is out of position. You want to have that spine as upright as possible, even before they bite on the bite stick. Visualize where that spine is. You want it very upright. Have them bite in the bite grooves. Make sure they're biting in the bite grooves to avoid this issue.
Right. Now, there's also another extreme if they're biting too far back off of the bite stick, or maybe the canine light is not lined up. We have that too far mesial. This is where we get that blurry anterior there, you can see. And so we're out of that focal trough.
Right.
And it's causing that blurry anterior.
So in this next image, we can see that the patient's head is basically tilted too far down, or angled too forward and too far down. So you can see the curvature there of the occlusal plane is off. So the solution would be to get them in an ideal resting position and get that Frankfurt plane aligned properly. So we have that Frankfurt plane from the tragus to the bottom of the orbit. Just basically a natural head position would avoid this issue. So I would, be grabbing their head and just positioning it back a little bit further.
And maybe having the maxillary occlusion tip down right about 10 degrees so we don't get that sharp V in this pan here.
Right, that's right.
Yeah. And on the opposite spectrum, where their head's tipped up too high, that causes that frown. And you can see those condyles are tipped out. So that's what we're going to see when we have the patients with their head tipped up too high. It's going to cause the pan with a frown. So do not want this image here. Paul, I'll let you talk about this one here where maybe the head's tilted one way or the other.
Yeah, so we can see on that image on the right there, the head, that they're just tilted way too much to the right. So aligning your mid-sagittal beam through the center of the head will avoid this issue.
And then the result, if they are positioned like this, is you get magnification on one side, the right side versus the left side on your panoramic itself. Now, the other factor that could happen is where their head's twisted. So that line could look like it's right through the center of the patient, the mid-sagittal beam, but they could be twisted. And if that happens, you get elongation where the ramus gets stretched out or your molars get stretched out, and you can see that is highlighted here with the double arrows on right side versus left side.
Right.
This next slide, Paul, I think we all come across this where we ask the patient to put the tongue flat to the roof of the mouth and they don't, or how are we telling them? So here we can see where we have the dark shadow going through the maxillary arch. That is actually the air that's behind the front teeth. And several offices, when we instruct them on how to position, how to relate this to the patient, I have them swallow and then keep the tongue flat to the roof of the mouth. And that should eliminate that shadow that is interfering with those maxillary teeth there. Often we see lower anterior distortion, and that's where we have the patient they're not standing up straight. We want that spine straight and their chest right up against the chin rest there. And we had talked about that when we did our patient positioning a little while ago. So it's really important to make sure that their body is right up against that, spine is vertical, and that's gonna eliminate having that washed out anterior region there. Paul, what happens whenever the patient moves? If we don't have those temple supports tight, what happens then?
The entire image usually is going to be blurry and not well defined.
Yeah, so that's really important to get those temple supports nice and tight, and that's going to eliminate any or reduce the chance for any patient movement there. If we are using a lead apron and we see any radiopaque triangles at the inferior border of the pan, that's going to be where the lead apron was improperly positioned. So I always say you want to have the lead apron high in the front and low in the back. Since when we're imaging our anteriors, we want to make sure that that lead apron is properly positioned on the patient, and that's going to remove any artifact that we have at the inferior border of the pan itself.
Right. And
take us through a brief overview of, like image that's too light or too dark, underexposed, overexposed. What happens there? What has happened if we see that?
So when you see an image like that, a lot of times if it's too light, we're underexposing it. And if it's too dark, we're overexposing it.
The Vatech software, as we just reviewed, it auto sets the KV and the MA and the time based on the patient, the age of the patient, and the morphology. Sometimes if we forget to set that, or if we forget to add patient information or change man, woman, and child, this is when this could cause underexposure or overexposure. So always make sure that we have it on the proper patient's body type and bone density, and we should not have this issue here.
So Jim, in this next image, we can see the patient clearly has earrings on, and that will not only show up in your image, it'll cause streaking. That's what we can see in the upper two white boxes on top there. As it goes around, it causes streaking on the opposite sides.
Yeah, so ensure taking off jewelry, glasses, necklaces, right?
We recommend, having the patient take off anything metal from the neck up as much as possible.
I agree. That's going to give us that clean image without that distortion and streaking effect there.
Right. So
here's a really nice image. I would say this patient's been positioned properly, but Paul, what are you seeing in the image?
Well, I would say the head's tilted slightly, but we see the earrings in the image. And then again, also the streaking above that look like little rectangles are from the earrings.
Yeah, so I think that's the thing of, we get our earrings in here and the sinuses, we get that streaking effect and the distortion above those earrings. Otherwise, beautiful pan. Let's look at one more before we conclude. What are you seeing here on this image?
See that little white area on the bottom portion of the image, which is going to be the vest essentially creeping up on the back of the neck, causing that little white spot there.
So Paul, I think that concludes our review of the panoramic imaging troubleshooting or image IQ. I think the main things are ensuring that we are positioning the patient proper, taking off the jewelry, which should result in a clinically diagnostic image. Now that we have captured our CBCT data, let's go ahead and look at some of the basics in the EZ3DI software. First, I'm going to double click on the CT icon, and this will launch our EZ3DI software. First thing I would like to do is look at our main menu and settings. Things to change: teeth code, make sure this is set on universal. We want to come over here to View, 3D Viewer, change plane type from outline to plane. Next, we will navigate to 2D Viewer, change our panorama view default thickness to either 10 or 20 millimeters. Lastly, we will click on Navigator, go to Volume Panoramic Navigator, default interval, we want to change it to 1 millimeter. From there, we will select OK. An overview of the EZ3DI software. You'll notice at the top tabs, NPR, section, all the way through consult. These are various different tabs and clinical functionality. For this training, we will start in the NPR, and we will also work in 3D Pan. Your NPR window consists of 4 sub-windows. Your coronal, and you'll notice it's highlighted in yellow here. Your axial, which is highlighted in blue. And your sagittal, which is highlighted in reddish orange. Note in the corresponding windows, the color slices here. So I have my red reference line, if I grab this, left click and drag, I am dragging lateral and medial and moving the sagittal window. The blue axial line, if I drag this up superior and down inferior, also changes in the 3 windows. Lastly, my coronal yellow line, I can move this anterior and posterior. Another way to move this line is to use the wheel on your mouse. Simply roll the wheel and you will see the image scrolling up or down, in this case, in your axial window. Another thing to note, everything is highlighted. Your axial has right here, left, sagittal shows anterior and posterior. The lower right window in this case is your 3D virtual rendering. I can left click and drag and move this around. We also have our quick icons at the bottom, which we can click through. To enlarge one of these windows, I can either hit Enter on my keyboard or I can double click on the corner of the window. In this case, I will double click on the corner of the axial window. I'm also going to hit the space bar on my keyboard, which will toggle these crosshairs on and off. Space bar toggles on. Enter will minimize that window again. Top toolbar includes features of panning, which allows you to move the image around. Left click and move this around. Magnifying in or out. Left click and drag. Your measurement tool length. Click, and left click will give you your length, and I can drag that out of the way. To delete, right click and delete. The next icon is your nerve trace. We will look at this in future trainings. Your camera capture, which takes a screenshot of the entire window. And one of the more important icons here is your reset view. This will reset the view to the original position. Your next icon is export. This allows you to export the CBCT data with your project, allowing the user that you're sending this to be able to open your data in a Vatech viewer. Just to the right, we have our drop down, including measurement, capture, annotation, all the way through, etc. Next, let's look at an overall view of your Vatech data. I want to grab the axial slice, move this to the superior border of the scan. I'm going to come down to my axial window, spacebar. I'm going to use the wheel on my mouse to scroll through my image. I can see on my alternate windows, my blue axial slice tells me where I'm at within the patient's anatomy. Here, maxillary sinuses, wing of the sphenoid, nasal concha, our septum. As I scroll down inferior, start to see our palate. We can look at our individual root tips, the incisive canal. Keep scrolling down. Lingula here and here. We can also see on this 3D rendering where we're at with the blue slice. Let's keep scrolling down inferior, going through our molars. You can see RTC there. And as we scroll down inferior, mental foramen on the right, epiglottis here, and now we are to the inferior border of the scan. That is my first step in reviewing my image. Next, I'm going to move my coronal slice to the front of the scan, select the space bar, use the wheel on the mouse, and let's scroll anterior, posterior, going through 8 and 9. Gives a good visualization of our maxillary sinuses, that sinus floor, width of our ridge, height of our ridge. And I'm following with my eye, going all the way posterior back through the entire scan. Hyoid bone here. And now we are back into our spine and at the posterior border of the scan. I'm now going to select the spacebar and reset my scan. That is our MPR window, brief overview. I'm going to go into my 3D pan. The 3D pan essentially takes your 3D rendering and flattens it out into a navigatable image. Here are your quick buttons. Center of the screen, we have our navigation window. I can left click and drag in a negative space to move this around, exploring the image. I can also double click on an area to navigate quickly to a certain area. In this case, I'm going to go over to my virtual rendering or VR coloring and select MIP or maximum intensity projection. Here you will see the grayscale of the image. Next, I will double click on tooth number 19. I'm going to come here to these blue circles and left click and rotate. As I do that, you will notice my red lines are vertical following the long axis of tooth number 19. Below this, I have my section. You can see your buccal and your lingual. These 3 vertical red lines correspond to my 3 sections at the bottom of the image. I will now double click on the single center image for one image. If I use the wheel on the mouse, I am scrolling back distal and then mesial. I can also drag this blue line to the crest of the ridge. I'm going to come up and take a measurement across the ridge and down to our nerve. Left click to drag these 2 measurements out of the way. Now I'm going to go ahead and place my implant. Go over to the left, insert implant. For this demonstration, we will look at single implant, number 19. I can select my company here. In this case, I have Neodent. We are on the GM Helix implant lineup. I'm going to come down to scroll through, find my implant. Select Insert, and I get this pop-up window that tells me to place the implant. It's telling me to place number 19. Come down to my sectional slice, and I'm going to click wherever I want the crest or the platform of the implant. I can click on my implant and rotate as needed, and we can see our implant placed on this window. I do have my bone density window here. I can rotate around. I see this green arrow, which corresponds to my scout. We are looking buccal in lingual. Grayscale or density range on the left, and it is also color-coded on the implant. From here, I may come in and take a screenshot. I'm going to navigate back to the MPR window and change our virtual rendering. We can see our virtual rendering here. Lastly, I want to look at exporting our data. If I come up to the icon here, export, click on this, change this to local disk. I'm going to add the viewer. I'm going to click on save. This will allow us to export this to your desktop or a designated location, which includes the viewer and the DICOM. This was meant to be a brief tutorial to get you started navigating the software. You can find additional training modules in the Vatech Education Academy, which will guide you through your process of learning this software.
This concludes our training session for today. If you do have any questions, feel free to email us. You can also sign up for additional training at our Vatech Education Academy on the online scheduler. Thank you for choosing Vatech as your valued imaging partner.